You're on Just Keep Swimming with Elle. This is my episode 2, Alone in the Deep Blue Sea, Living as a Survivor. So it is the middle of summer right now, and as much as I love the fresh air, especially when I spend most of my time inside, but I haven't been outside much. I haven't been to the ocean. I haven't walked in the sand or splashed in the waves. My skin loves the salt water so much that in the past, my husband always fills empty bottles of water for me with the salt water from the sea so that I can pour it on my skin at home. I love cooling off, swimming pools, and my father has a built-in swimming pool where he lives. It's actually an indoor-outdoor pool with mineral water. I think they call it mineral water. And unfortunately, this year it's closed for renovations. So Just Keep Swimming hasn't been much of a literal option for me. And not being able to enjoy being outside, out of bed, has been holding back my motivation. These past couple weeks, and I really should say months because it feels like it's been endless. But specifically in the last couple weeks, I have been extremely overwhelmed with pain. Feels like a form of pain that my body either doesn't remember or hasn't experienced before. It feels like a combination of recovering from a really bad car accident where you have been in a body cast and now you're learning to move your limbs. But with every step and every movement, it feels like you are breaking bones or pulling every muscle in your body. The pain has been so bad. I've had to take sedating medication on top of my regular medications just to fall asleep. I did meet a new doctor. I always say I interview them for the team because I have a team of 11 doctors at this point. And if they don't have the mind capacity to see all of my medical complexities and look at the big picture rather than the narrow picture that most of these specialists do, this doctor checked off the boxes. You can tell that she went through my file and her mind was open. And based on all of the testing I've had previously and all of the records, she didn't feel that I needed to have any more neurological testing at this time and no additional treatments. In hindsight, it's good because I have enough. But it doesn't help the pain and neurological symptoms that I've been having. I'm still basically dealing with them on my own with the tools that are on the table from my providers currently. The amount of cranial radiation that I received as a child was so immense that there is high risk for more significant neurological damage. And I'm knocking on wood that I don't get that in the future, but I do feel some of the symptoms and side effects. So in addition, and also can explain a lot of the pain that I've been having, is the number 2 on the beast list. And that is the autoimmune disease that I was diagnosed with about 7 or 8 years ago. But in hindsight, they said that I've had it most of my life, if not all. Specifically, it's non-specific autoimmune disease. My immune system is basically attacking my body. But in the list of specific autoimmune diseases, even though I check many of their boxes, I don't fit into those diagnoses, which is fine. Some of the doctors say, I'm glad it's not this, I'm glad it's not that. But now we're left with more anomalies. A lot of doctors use the term undifferentiated connective tissue disease, UCTD, but I only have heard and know it as nonspecific autoimmune disease. So it's not lupus, it's not rheumatoid arthritis, it's just nonspecific, but it's a beast. My symptoms and symptoms of this disease include pain and soreness in muscles, tendons, and joints, a widespread whole body pain, fatigue, swelling or stiffness, dry eyes or dry mouth. I get sores all around my mouth and even inside. Rashes or sensitivity to sunlight, low-grade fevers or not feeling good. My body literally heats up like an oven, and that usually happens at night when I'm trying to sleep. And I'm not in perimenopause yet, so I'm going to brace myself. Hair loss, which don't know if I mentioned it before. About 4 years ago, patches of my hair with the follicles and the skin fell out. Nerve issue pain, numbness or tingling, sometimes pelvic pain, which I get a lot. And the treatments depend on the symptoms and how active the inflammation is. So to add icing to this cake, I naturally have a higher level of inflammation running through my body, which makes injuries and when you're sick, kind of feel exasperated. Treatments are widespread as well. They include things like ibuprofen or naproxen, which I can't have naproxen because of my heart, and I have to limit ibuprofen because of my heart. Hydrochloroquine, which is the drug they were given COVID patients, and now my body can't live without that drug. It seems to keep things calmer. Definitely not calm, but calmer. It's supposed to reduce joint pain, rashes, fatigue, and is supposed to help to prevent the progression of the symptoms. Steroids like prednisone for short-term flare-ups, which I have been on, I don't know, 4 or 5 times a year since I had leukemia. Immunosuppressive medications. I have been in a drug trial for the past 6 years, and one of those drugs is an immunosuppressive drug. And I am currently on an injection, which I started taking every 3 weeks at home, but now I have to do it every week because nothing is calming down this beast. Trying to manage symptoms at home on your own is so important with this disease, but doesn't mean it's easy. Gentle exercise to maintain strength and flexibility. And lately I've been told that my muscles have atrophied since I have been spending so much time in bed. Physical or occupational therapy, if the pain becomes limiting for movement at home, I will tell you that I have been kicked out of 3 different physical therapy programs because pain and autoimmune disease is not my only illness. It's not my only beast. And sometimes the other symptoms get in the way of me getting out of bed, getting in a car, and driving. So, yeah, that's really not a realistic option for me. Good sleep habits and stress management. Oh, sleep. Sleep is a big problem for many reasons. I'm not going to overload this episode with all of the reasons. We'll just leave it as I am doing the best I can. A Mediterranean style diet, which is supposed to help reduce inflammation. Again, I'm not going to go there in all of the details. I do my best to eat what I can every day, and it's not easy. And protecting yourself from sun exposure or outside irritants that can cause just regular poison ivy, bug bites, sunburns, all that, because I get lesions and sores and rashes and, things that look like bites or poison ivy or whatever. And I don't even go outside. So, yeah. Treatments are usually based on symptoms and the organs involved rather than the label itself. Some people have this as a mild disease and remains in this nonspecific threshold for years, and others develop more specific characterizations or characteristics. And some, like me, are so complex, we're just shooting drugs at the symptoms as they come, and they come fast. One of the lingering questions, and this is a question about a lot of my failing organs, is did I have autoimmune disease and that's why I couldn't fight off the cancer cells when I was a kid? Or did I develop this disease after my cancer treatments destroyed all types of immune fighting cells? Even though I have medical records going back to when I was 4, there was no testing for this or for any of the other organs at the time. They were just trying to keep me alive and cure cancer that was killing 78% of kids that were diagnosed. So depending on the situation, a rheumatologist or immunologist might use anti-inflammatory medications. And the way that they test for this condition, disease, symptom, is mostly through labs, an anti-nuclear antibody, which is a test for connective tissue autoimmune disease, an antibody panel. It's called anti-dsDNA, which is specifically used when lupus is suspected, a rheumatoid factor, and anti-CCP, which helps to evaluate rheumatoid arthritis, an ESR and a CRP that looks for inflammation, complement C3 and C4 can be low with certain autoimmune diseases, particularly with active lupus, a CBC that checks white blood cells, red blood cells, hemoglobin, and platelets. Now, my white cells have been elevated since I was in remission. How old am I? I guess 38 years ago. So I've been in remission for 38 years. And CBC and CMP, which evaluates liver and kidney function and electrolytes. These two are common labs that most people have, like during a physical. Urinalysis and urine protein testing, because autoimmune diseases can affect the kidneys. And depending on symptoms, doctors may also check thyroid antibodies and immunoglobulin levels. An immunologist may additionally order quantitative immunoglobulins to test how well your immune system responds to vaccines, particularly if you've had frequent or unusual infections. Yeah, that's me. A positive ANA alone does not mean that you have autoimmune disease. An ANA titer pattern, other antibodies, symptoms, examination, and other laboratory findings in a combination is what will determine if you have this disease. So after years of skin lesions and sores developing all over my body, and skin infections and rashes developing for no good reason, I've had many biopsies and exams and blood work. In the beginning, my symptoms presented as a form of lupus, and when patches of my head started developing lesions, and in 4 different location parts of my hair, along with the follicles and the skin, just fell out, which made my doctors believe that I had T-cell lymphoma. So I spent another year of cancer specialists and biopsies. T-cell lymphoma was ruled out. However, they could not explain why my T cells were so elevated and why patches of my hair and skin fell out. So what do you do? What do you do when this happens and you go to the top of the top? And good news, Al, you do not have lupus. You do not have T-cell lymphoma, but we don't know what's causing this, and we don't have a reasonable treatment. Nonspecific autoimmune disease with treatment at a hair loss clinic at the Leahy Clinic in Massachusetts. I found them. Nobody referred me. I have been to hair loss clinics with the specialist claiming that if you give them thousands of dollars, they can regenerate your hair cells and hair transplant this and blah, blah, blah. And as desperate as I was to fix the problem, I wasn't buying it. And it's a good thing that I have developed instincts when it comes to the medical world. So I found this clinic, and I live in the state, and nobody told me about this. All of the specialists that I saw pertaining to all of these symptoms, and nobody told me that there was a hair loss clinic at a major hospital in Massachusetts. So going to this clinic has been a game changer for me, even though for 2 years straight, every 2 months, I received 40 injections into my head, 10 in each 4 of the sites, directly injecting drugs to help stimulate the skin and hair cells to regenerate. In addition, the specialists are immunologists, and my doctor worked with leukemia patients at Boston's Dana-Farber. So she was able to look at my case, at me, from a wide lens. And that is something I definitely needed while going through all of this. So in a combination with these injections on my head that I received for 2 years, I have also been receiving 2 oral medications. And one of them is to help with the cell regeneration internally, and the other is to help calm down the inflammation, the hydrochloroquine. In addition to that, I have an injection that I give myself at home, Initially, it was every 3 weeks, but because my immune system has been acting up so hard lately, we are now doing it once a week. I also have to take a low dose of doxycycline, and that's to kind of give my immune system a protective layer for in case another attack happens. It's kind of just giving it a layer of defense. And since meeting this doctor and working with this hospital and doing the injections in my head and injections at home and oral medications, I will say that I have much fewer lesions that have come up. Much fewer, but hasn't eliminated unexplained rashes or infections. And not all, but some of the skin and hair follicles have started to grow back. I do understand that it will take time to visually see the effects, but overall, I do feel better about my head and my hair since seeing this team of specialists and having this doctor and working with one of my great friends who helps kind of cut and do highlights around the areas to kind of, create like a visual. I don't know how to explain it, but it covers it up. So I do feel a lot more confident. Our immune systems are supposed to be our body's defense network. It's supposed to protect us from things that can make us sick, including viruses, bacteria, fungal, parasites, and abnormal cells. White blood cells, antibodies, how would I say it like that? Antibodies, lymph nodes, bone marrow, spleen, thymus, and other tissues. Immune system problems generally fall into a few categories. Underactive immune system, which can make infections more frequent or severe. An overactive immune response that can cause allergy-like symptoms. An autoimmune disease that happens when the immune system mistakenly attacks the body's own tissue. Being a cancer survivor and having autoimmune disease, I am at very high risk for diseases like COVID, pneumonia, cancer, infections. And because of all of that, I have to do extra testing to constantly monitor my cells for inflammation, blood counts, cysts, tumors, and areas where cancer cells commonly develop. Especially for women, I have to have the invasive test once a year, which doesn't sound bad to most of you. I was doing it 3 times a year. And as a woman, and as women listeners may know, when you go to have this test, you're sitting in that very uncomfortable half bed with stirrups, and you're supposed to relax your pelvis, and your knees are supposed to lean to the side outwards. And you're supposed to do all this where they're doing a surgical procedure. Now, I love my OBGYN. I have been with her since I have been seeing an OBGYN. And I couldn't bear continuing to have this procedure in her office. So, with other team members of my care team, it was recommended to me that I go into Boston at the Brigham and see a specialist who only specializes in the cancer-causing virus HPV. And in her clinic, since they specialize in testing and monitoring, they have created exam rooms that are much more comfortable. They offer sedatives and will sedate you if you need it. And most importantly, they prep you to limit the amount of pain and pressure that you will feel. And every year that I have to do this, I feel so much better knowing that I am not going to be put through such torture by going to my local OB. And again, she's still my favorite. I still see her for regular things, but to have this test to monitor, basically they're waiting for the cancer to attack. It's much more reasonable and easier for me to just do it. And for anyone else that has to deal with this, I highly recommend going to this person or the facility. I do believe there are other doctors there that do it. So again, it's at the Brigham and Women's Hospital in Boston, Massachusetts. So Alone in the Deep Blue Sea, it's really the best way that I can describe the lonely feelings that I carry around with me. When I'm overwhelmed with pain and discomfort and none of my go-to resources are helping, and I've done everything I can to distract myself, tears will just start falling down my face, and I feel like there is no sun in sight. Trying to explain these medical complexities, especially when I'm so overwhelmed by all of these symptoms, is really exhausting. If pushing myself to work through it actually led to recovery or even a break, I would just keep swimming. But that hasn't been the case lately. And I'm so worn down. I don't have the energy to keep trying. And I say that in a way that it's not that I'm going to get out of bed every day. I'm going to do my best to take care of myself. But to try to overcome all this is really, I think, what I mean to say. I have to accept that the damage to my body was done a long time ago. And the older I get, and the older we all get, the natural parts of aging are setting in and challenging the organs in my body that are already defeated. I wouldn't call myself an empath, but I am an empathetic person. And when someone I care about is going through it, whatever it is, my brain automatically adds to my to-do list ways to help them. I am always trying to put myself in their shoes, and I think about what ways I can help and what ways would I need help if I was in their shoes. Even when I'm in it, and I say it, the beast, when I can barely get out of bed, when I can barely get food down, when I can barely move around my house to take care of simple things, I become focused on how I can help them to make sure that they are okay. But I don't always get that from the people around me. And my 15-year-old son seems to be the most empathetic or empath person around me. And I don't know if I taught him this, but he has this innate ability to sense my hurt, and he knows what to do, and that really warms my heart. He doesn't ask me to explain. He doesn't make me feel bad about not pushing hard enough, and gives me the biggest hug. I got you, Mom. And always says, let me know if you need anything. Now, I really don't think that I need a lot, but it's the little things. And sometimes it's easier to just not ask for them, because I've had to learn how to adjust my expectations. And I really don't have expectations right now from my 15-year-old, but the way he responds without question just makes me so proud to know that he is this type of person. And not that it's our job to help and take care of other people, but to have empathy for when someone is breaking down or is sick and doesn't feel well and is just tired of not feeling well all the time. I know that other people care, and just because they are not like my 15-year-old son, I know that they care. They just don't know how to show that they care, or they are caring in the best way that they know how to. And that's okay. So when I spoke about expectations, this is where it's important for all of us, for anyone. You have to set your expectations to a level where you won't feel let down waiting for someone who is just not able to help and support you in the way that you need. You won't feel let down if you set your expectations to a level they can meet. It will become less of a burden, of a hardship, if you do this. Because if you don't expect too much from someone, and then they go above that expectation, the only feeling you will feel is that you're loved, or being, someone cares about you. I've tried to figure out ways, because at the end of the day, we all need help. Eventually, we will all need help in some way or another. So you have to come up with ways to say it. Like for me, I just don't feel good today. And I know that I have to take medication, and I know I have to eat something. So saying to your loved ones, please make sure that I take my medication and that I eat something. For the people that may not realize the level of not feeling well, or the almost desperateness in what you need, sometimes letting them know that in a very simplistic way will help them to help you. I would like to think that I could give a course to caregivers, but in the end, they just love and want to help us, but they're doing the best that they can as well. And caring for someone who's sick is never easy. It's hard to watch. It's hard to not be able to switch places with them. So having reasonable expectations of those who are around you. If you need help, you have to ask specifically, no matter how hard it is, how much pride you have, how much you don't want to see the look on their face of annoyance that you need help. Even though you see how hard they're working at their job or to take care of the other stuff that needs to be taken care of when you can't do it. You just have to ask for help specifically. I do know that I am loved, and I promise that you are loved as well. But more often than not, those who love you are trying to understand. The reality is they don't. And that's not their fault, and it certainly isn't yours. And like myself, we all have a responsibility to ourselves and our loved ones to do everything in our power to take care of ourselves. And I'm not saying it's easy. I'm not saying if you just do these things, everything will be fine, because I know for me, it's not gonna be fine. But do I want to spend today shutting down, not living, being in the darkness? Or do I want to try and take some of my power back? Have some control of what my body does today? The sun is out and it may be a little too warm for my body, but my goal today is to go outside and water my beautiful plants and to sit in my little rocking chair on the side of my porch. And even if it's for 5 or 10 minutes, play some music and just be outside, even if it's for that short period of time. I have doctor's appointments and hospital appointments lined up, I feel like every 2 weeks and sometimes more. But I have to go. I have 23 medications, and 2 of them are injections, and 1 hurts like hell. But I have to take them. Trying to eat a balanced diet, and in my case, just eat something that will stay down diet. You have to just do your best. It's not a be-all, end-all type of situation, I guess is how you would say it. You just have to do your best. Exercise, light or modified. My doctor told me 15 minutes a day. That's all I'm asking you to do. So I went on YouTube because I can watch YouTube on my TV in the living room. And I browsed through a couple of, 15-minute workout videos. And because my muscles are atrophying, I needed something like Pilates or whatever. And I don't know if any of you have experienced this, like through meditation apps or something. I can only do these things if it's like a specific person. It has to be a person, the way they talk, and the way they are performing in the video. So I found one. And some of it is hard. It's always hard for me to lay flat on my chest. because I have whole body lymphedema and that pressure really hurts. But I modify it. I use a pillow. I lay on a pillow, and with my puppy who's running around the house, always tries to come in and join, which is adorable and makes me laugh. But if I can, which I haven't been doing, if I can focus on just doing that 15-minute routine every day, then I can check that off of this list. Another really big one, and I get this a lot. I don't know how you do it. You deal with all the stuff. I have to advocate for myself. I have been advocating for myself since I was 4 years old. Even with my parents there, they weren't there for every minute. And I had to be the voice for myself. And as smart as most of these doctors are, they don't know everything. I have been sick way longer than most of them have been in practice. And if you don't question, then you're just accepting that they are going to be the driver of your ship. And I don't accept that. If something doesn't sit right with me, I question it. If I need to talk to my doctor and all of the administrative call center red tape bullshit is in my way, I push. I go at it at every angle. And when I finally reached my doctor, I let them know how hard it was for me to get to them. You have to question. You have to advocate. This is your life. This is your body. And again, I've been doing this for most of mine. I would say that my job is a professional patient. And I don't know everything, but I do know a lot about this stuff. And even knowing all this about all this stuff, I still suffer. And I'm constantly trying to find the sun. I'm constantly trying to keep going. But I can't do it by myself. And lately, it has become a very lonely world for me. And even though it feels lonely and that makes my heart hurt, I have to keep asking for help. I don't feel like a burden, but this situation is a burden for others. And I do know that, and I do understand that. But I need help. So even if you feel this way, you can't do it alone. You have to advocate. You have to ask for help. And if you feel stuck, if you know someone who is stuck, you can always reach out to me. And if I don't have the answers, I will find the answers. Because I've had to do that my entire life. I'd like to thank everyone for listening. I'm gonna try and not make every chapter, every episode dark. I am going to keep trying to swim. I will continue to look for the sun, for the light. I do this one day at a time. It's the only way I can possibly do this. So I'm going to end this here. I'm going to go outside and water my plants. and hopefully that will lead to a better day.